Good day, everyone! We are the Group 1 of BSN 1-4 from the Department of College of Nursing, and we are here to present about one of the diseases in nervous system, specifically, all about Alzheimer's disease. Meet my team. I'm Reina Marie Andalahaw.
I'm Cyril Alfonso.
I am Joshua Alan Arellano.
I am Ashanti Naomi Abel.
I'm Hannah Ibasa.
I'm Ed Gabriel Silbanan.
I'm Kathleen Bandanya.
So now, without further ado, we will discuss about Alzheimer's disease. Let's first question, what is Alzheimer's disease?
Alzheimer is a disease of the brain that causes problems with memory, thinking, and behavior. It is one of the leading causes of dementia, a chronic mental disorder caused by brain disease or injury that affects over 40 million people worldwide. This disease has a devastating impact on many lives, and yet finding a cure is something that researchers are still working on. Well, an interesting fact, Alzheimer's disease was described for the first time in 1906 by the German psychiatrist Alois Alzheimer. Alzheimer's disease is considered a progressive neurodegenerative disease of the brain that results in the degeneration or loss of neurons in the brain, particularly in the cerebral cortex. This leads to memory loss and cognitive impairment, frequently prohibiting affected individuals from doing simple daily tasks.
Memory will change as people grow older. We all know that the risk of Alzheimer's disease and other types of dementia increases with age. For most people with Alzheimer's, signs and symptoms first appear in their mid-60s or later. But what are the common signs and symptoms of having Alzheimer's disease? Alzheimer's disease causes increasing problems with memory. Everyone can experience memory loss, but patients with Alzheimer's disease is more serious and complicated. Those with this kind of disease may frequently repeat questions or sentences, getting lost in unfamiliar places, cannot remember their own names, regularly lose belongings, having difficulty expressing themselves, and eventually forgetting the name of their loved ones. Second is that problems in concentrating and thinking, especially when it comes to abstract ideas like patterns and numbers. AD patients lose their ability to comprehend and use numbers. They also lose their ability to carry out fundamental actions like dressing, preparing meal, and taking a bath. Third is that difficulty in speaking or writing with words. As we try to observe patients with Alzheimer's, they frequently having trouble to speak and write their own names. AD patients have problems or impairment in their frontal lobe, which is responsible for speaking, writing, problem solving, judgment, and more. Next one is problems in making reasonable judgment and decision-making skills. Alzheimer's disease can affect a person's ability to make decisions because it can target the parts of the brain that involves remembering, understanding, and processing of information. AD patients can also forget to wear their own clothes and dress inappropriately inside or outside of the house, and as brains becomes weaker, they can also be a victim of scams. Fifth is that problems in understanding visual images and spatial relations. AD patients having trouble to figure colors, images, and structures. Also, if they look at the mirror, they will think that there is someone else in the mirror and not realize that they are the person in the mirror. Sixth is that changes in mood and personality. Patient with Alzheimer's disease is very sensitive with their emotions. Issues could involve depression, mood changes, social isolation or lack of social contacts, suspicion of others or an instant of suspecting something wrong to others without thinking, easily irritated, very aggressive, alteration in sleeping patterns, wandering, delusions, and lastly, loss of self-control. People with one or more of these signs or symptoms should see a doctor. Remember, early diagnosis gives big help for treatment and management of the Alzheimer's disease.
Now, for the causes of Alzheimer's disease. Well, there are still unanswered questions regarding the main cause of AD, but researchers are mainly focused on two proteins. The first one is the amyloid, specifically the beta amyloid. and the second one is the tau protein. These two proteins will have an abnormal buildup around the cells, brain cells specifically, that causes the Alzheimer's disease. Focusing on amyloid, amyloid forms the amyloid plaques. The form amyloid plaques contain the beta-amyloid protein. And fun fact about beta-amyloid protein is that it is an amino acid peptide formed by the proteolytic cleavage of amyloid precursor protein, or APP, by the gamma and beta secretase. Those amyloid plaques are the gradual buildup and accumulation of protein to neurons that will interfere with the synaptic activity. It causes an inter- and interneural dysfunction, which primarily leads to the cell's death. Moving to tau protein. The tau's normal function is mostly involved in microtubule assembly, which is essential for the neuronal development and normal axonal growth in a healthy brain. While in the presence of Alzheimer's, the hyperphosphorylated tau protein changes into a helical filament known as fibrillary tangles, or NFT. This then will be distributed in the neurons of the medial temporal lobe, especially in the hippocampus, the lateral parietal region, and the frontal association cortices. The NFT blocks the communication of nerve cells, which hinders them from carrying out their process. There will also be a decrease in neurotransmitters involved in memory, which is the acetylcholine, in the brain. This will primarily lead to the death of nerve cells, which slowly spread throughout the brain. It starts in the region of the brain that controls the memory. Together, the amyloid plaques and neurofibrillary tangles will interrupt the external and internal function of neurons in the brain that causes the aforementioned symptoms of the Alzheimer's disease.
Although it is still uncertain what triggers Alzheimer's disease, various risk factors are known to raise your probability of developing the disease. Number 1 is age. Age is the single most significant risk factor of Alzheimer's disease. Although older age does not cause Alzheimer's, but age is the most important known risk factor for the disease, since the number of people with Alzheimer's increases, affecting an estimated 1 in every 14 people over the age of 65 and 1 in every 6 people over the age of 80, according to research. Family history or genetics. The gene you inherit from your parents can increase your risk of developing Alzheimer's disease. Having at least one apolipoprotein gene increases your risk of developing Alzheimer's disease by 2 to 3-fold. Down syndrome. Individuals with Down syndrome are at a significantly greater risk of acquiring a type of dementia that is either identical to or very similar to Alzheimer's disease, because the genetic abnormalities that cause Down syndromes might cause amyloid plaques to accumulate in the brain over time, leading to Alzheimer's disease in some people. Head injury. Head injury is a considerable risk factor for dementia, yet it is preventable. People who have suffered a serious head injury may be more likely to acquire Alzheimer's disease, but more research is necessary in this area.
For the cardiovascular disease, according to research, all diseases and lifestyle choices connected to cardiovascular disease can raise the risk for AD. Examples of it are smoking, obesity, diabetes, and high blood pressure. But these risks are avoidable. You can lower the risk by quitting smoking, having a nutritious and well-balanced diet, having an active life both mentally and physically, reducing weight if only necessary, and lastly, having health checkups as we age. Now, for the other risk factors. New evidence reveals that other factors that are relevant, but it does not mean that it is the main cause of dementia. Those are the hearing loss, untreated depression, and loneliness or isolation.
Moving to our next slide, this part is the diagnosis of Alzheimer's disease. To begin with, similar to other diseases, a diagnosis is performed in order to determine the possibility of having a specific disease or what its current state is. In the case of Alzheimer's disease, healthcare professionals may perform or ask the patient the methods indicated on the slide. First one is medical history. This is done by inquiring about the patient's present and previous illnesses, the medications they are taking, and any history of Alzheimer's disease or other memory problems in the patient's family. Before performing a neurologic exam, the patient will also have all of their current vital signs, including blood pressure, heart rate, temperature, and pulse rate assessed. The blood and urine test comes next. Even though Alzheimer's disease mainly affects the brain, one of the most prevalent diagnostic procedures is still used. Typical lab tests are done to rule out alternative causes of symptoms, include blood counts, vitamin levels, liver and kidney function, mineral balance, and thyroid gland function testing. Then there's mental status testing. Memory, problem solving, attentiveness, counting, and language ability are all tested in this exam. This type of testing can also be used to monitor the development of Alzheimer's disease, as it is done to assess a person's cognitive abilities and see whether any difficulties are improving or worsening. Another is neuropsychological testing, which is comparable to mental status testing. This exam contains assessments for attention, memory, language, reasoning ability, behavioral change, personality, and emotional stability. This type of testing can also be used to monitor Alzheimer's disease development. It differs from mental status testing in that it employs a collection of tests to measure diverse aspects of cognition and behavior, whereas mental status testing focuses on broad assessments. Spinal tap. This test, commonly known as a lumbar puncture, is done to search for tau and amyloid proteins, which create plaques and tangles in the brains of Alzheimer's patients. Its purpose is to collect cerebrospinal fluid to test for infections, inflammation, and other disorders.
For the next diagnosis, we have the brain imaging test, in which three types of tests are included. The first is the computed tomography or CT. This kind of scan demonstrates the physical abnormalities in the structure of brain tissue that occur in the later stages of Alzheimer's disease, like a decrease in brain size, enlargement of the fluid-filled chambers of the brain, and broadening of brain tissue indentations. For the next type of brain imaging test is magnetic resonance imaging or MRI. Earlier at computed tomography, it was mentioned that it shows the physical abnormalities in the structure of the brain, while here it is defined as revealing the physical changes of brain tissue that can also only be observed in the later stages of the said disease, including the brain shrinkage. We should also be familiarized with functional MRI or fMRI, since it is a type of MRI that measures variation in blood flow to assess the activity of the brain in particular region. It is used to test treatments and for researchers to examine how the brain alters throughout the course of Alzheimer's disease. Finally, there is position emission tomography or PET. Here it depicts and detects the abnormal brain activity in an Alzheimer's patient. In contrast to other types of dementia, it can also aid in the diagnosis of Alzheimer's disease. Let us now distinguish between the two types of it. Amyloid PET reveals an amyloid protein buildup in the brain, while the images from FDG or fluorodeoxyglucose PET show how efficiently brain cells utilize glucose, because a decrease in glucose absorption is a symptom of Alzheimer's disease. Remember that only after that, when an autopsy analysis of the brain tissue is combined with clinical diagnostics, can Alzheimer's disease be accurately diagnosed. Thus, when people experience memory or thinking issues, they should see a doctor to find out if Alzheimer's disease is the root of their symptoms or another disease, because some of these illnesses may be curable. Even if the underlying disease process cannot be prevented, if Alzheimer's is a diagnosis, initiating treatment early in the disease process may help maintain daily functioning for a time.
Given the complexities of Alzheimer's disease, it is unlikely that any single medication or treatment will be useful in managing it. Current approaches focus on aiding people in controlling behavioral symptoms, maintaining mental function, and postponing or preventing disease symptoms. Although there is still no cure for Alzheimer's disease, there are medications that can help with behavioral challenges that may arise as the disease develops and temporarily slow the progression of dementia symptoms. Here are the medications. The cholinesterase inhibitors, which are medications for mild to moderate stages of Alzheimer's, the NMDA antagonist, memantine, a medication used to slow the progression of moderate to severe stages of Alzheimer's disease, and the aducanumab, which we will further discuss on the next slides. For mild to moderate stages of Alzheimer's disease, the cholinesterase inhibitors blocks the enzyme acetylcholinesterase, which is in charge of acetylcholine breakdown. Acetylcholine is a chemical that helps nerve cells communicate with each other. Cholinesterase inhibitors result in an increase in the concentration of acetylcholine levels in the brain, leading to increased communication between nerve cells, which in turn may temporarily improve or stabilize the symptoms of dementia. The usual side effects of this are nausea, diarrhea, vomiting, sleeplessness, or nightmares. The most widely prescribed cholinesterase inhibitors are donepezil, authorized to treat all stages of Alzheimer's disease. Galantamine is used to treat mild to moderate dementia, which is a sign of Alzheimer's disease. Galantamine will not cure Alzheimer's disease and it will not stop the disease from getting worse. Rivastigmine is a medication that is licensed for the treatment of mild to moderate Alzheimer's disease as well as mild to moderate dementia associated with Parkinson's disease.
Here we will talk about the different treatment for the moderate to severe stage of the said disease. First, we have the NMDA antagonist memantine, or what we call Namenda. It helps the person to live his or her life normally because it decreases the symptoms. Next, we have memantine. Memantine works and important for our brain chemicals, but having too much of it can cause brain cell death. Memantine and NMDA can work together because they work differently. Next, we have the donepezil rivastigmine patch that was approved to decrease the symptoms of having a moderate to severe stage of Alzheimer's. Lastly, we have the aducanumab, the first licensed medicine for Alzheimer's disease. It is an antibody that targets the protein beta amyloid that reduces the amyloid plaques. The amyloid plaques is linked with the brain lesions that causes Alzheimer's.
Now, for the managing a persons who have Alzheimer's disease can be hard for nurses and caregivers as they can prevent Alzheimer's-related personalities and behavioral changes such as sleeplessness, wandering, agitation, anxiety, aggression, restlessness, and depression. However, they can cope up with it by maintaining simplicity, one question or statement at a time, and create a daily routine so that the individual knows when a certain event will occur. Don't argue, just not to show your annoyance or anger. When possible, use humor. Provide a safe walking area for people and let the individual know that they are safe and that you are available to assist.
As was previously stated, Alzheimer's disease occurs in our nervous system and cannot be prevented. Hence, there is no recognized treatment for it. On that, prevention is not guaranteed. However, there is strong evidence that living a healthy lifestyle, which includes eating healthy or consuming a nutritious and balanced diet, quitting smoking and excessive use of alcohol, and being active in life may help lower the chance of acquiring Alzheimer's disease and other types of dementia.
Now then, the complications. Language loss can occur when Alzheimer's disease advances and cognitive impairment worsens. Alzheimer's sufferers may be unable to convey their thoughts, which might lead to complications. Impaired judgment may also have an impact on bad decision making. Moreover, physical functioning typically deteriorates in the latter stages of the disease, with weakness or balance issues and swallowing difficulties, which can potentially create complications. To keep the patient safe and healthy, it is vital to be aware of any potential Alzheimer's disease side effects, and this includes complications such as restlessness and agitation. Patients with Alzheimer's disease frequently experience agitation and anxiety. This includes the ability to think and comprehend may become weakened as the illness worsens. They may grow afraid and nervous if they are unable to make sense of a confusing reality. Next one is bladder and bowel problems. Other Alzheimer's disease symptoms include these. Some persons with Alzheimer's disease may lose the capacity to notice the need to use the toilet as the condition develops. This might be due to limited mobility or communication skills. Another will be depression. Some people with Alzheimer's disease also suffer from depression and are unsure how to handle their decreasing cognitive abilities. Sleep problems, mood swings, withdrawal from family and friends, and difficulty concentrating are all symptoms of depression. Individuals with cognitive impairments are more prone to it if people who do not have Alzheimer's disease overthink or get depressed as well.
We also have falls. Alzheimer's disease may also impair balance and coordinations. As the illness progresses, the risk of falling increases. That could result in broken bone and head injury. Next is infections. A person with Alzheimer's disease may lose control of basic physical processes such as their capacity to swallow and chew food. If this happens, they are more likely to consume food and beverage that may lead to pneumonia and pulmonary aspirations, both of which carry a high risk of death. Wandering is also another symptom of Alzheimer's disease. Individuals who have AD may experience restlessness and sleeplessness due to the disruptions in their regular sleep cycle. As a result, people may unintentionally leave the house while thinking they are running errands or driving to work. The problem is that they may leave home and become disoriented as to how to return home. Some patients who have AD leave their homes at night when everyone is sleeping. Another one is malnutrition and dehydration. A person suffering from Alzheimer's disease may find it difficult to consume enough fluids by refusing to eat or drink. They may also have difficulty swallowing, which prevents them from being able to take food or liquids. Dehydration can cause headaches, dry skin, dry lips, irritability, and drowsiness. Lastly, we have memory. Memory loss occurs in everyone, but in Alzheimer's disease, memory loss is persistent and worsens. They might regularly repeat themselves, overlook conversations and appointments, and forget about them later. Then they misplace their belongings and become disoriented in familiar places. Furthermore, those patients may eventually forget the names of family members and common objects, as well as struggle to find the right words to describe objects, participate in conversations, or express their thoughts.
Alzheimer's disease or AD is the most prominent of numerous dementia causes, and its prevalence is rising globally. AD pathology consists of amyloid beta plaques and phosphotoneurofibrillary tandems. It can be present in asymptomatic, mildly affected, or demented individuals. Despite the advances in our understanding of Alzheimer's disease, unfortunately, there is still no cure. While medications to target amyloid beta or tau are being developed, it is still unknown if they will be successful in treating the condition. Since Alzheimer's has no cure and it gradually renders people incapable of tending their own needs, caregiving essentially is a treatment and must be carefully managed over the course of the disease. Also, there are certain things that you can do to manage Alzheimer's disease patients. As of now, there is only one certainty. Continuous finding for basic and clinical research will enable us to diagnose and treat this devastating condition one day.
And lastly, for recommendation, as we all know, Alzheimer's disease is very complicated to handle. Receiving treatment may help to delay and lower symptoms and enhance the quality of life of the patient. It is highly recommended for AD patients and families as well as caregivers to consider the following. First is that reduce frustration. Show support and care to the patients. Be patient to handle them, and we need to understand them because they are unable to think properly. Next one is be flexible. In handling a patient with Alzheimer's disease, being flexible is a must. Adjust your schedule and expectations as needed to avoid frustration. Assure the patient that he or she is safe and that you're available to help or assist. Patience and flexibility are the key to deal with the challenges and frustration ahead. Next one, create a safe environment. This can be done by preventing falls, checking water temperature, taking fire precautions, and keeping matches, lighters out of reach. This will promote safety and lower the risk of injury. Next one, be educated and focus on an individualized care. As each Alzheimer's patients will experience symptoms and progression differently, we need to be aware and be understandable to take care of their health. Set realistic goals and focus on what you can do today. Set realistic expectations for yourself and use the skills you have to be successful in dealing with challenging tasks. If you think you or your loved one may have Alzheimer's, talk or check with a doctor. They can help make a diagnosis, discuss what you can expect, and help connect you with services and support. Eventually, there's no cure for this disease, but there are different ways to manage to lower the risk of Alzheimer's disease. Always remember, never underestimate the difference you can make for the patients. Step forward, reach out, and help someone that might need a lift. A helping hand can be a ray of the sunshine in the cloudy world.
Here are the references we use for the presentation.
Again, we are the Group 1 from BSN 1-4 from the Department of College of Nursing. And that's all. Thank you for listening.